This is Speaking of Pets podcast, where we give you up-to-date, accurate, science-based information when making decisions about your pet's health.
From experts in dermatology like my sister, surgery, internal medicine, CBD use in pets, the pet food industry, you name it. If it affects pets, we'll talk about it.
Today's Speaking of Pets podcast is sponsored by Blue Buffalo, the maker of natural pet foods. Love them like family, feed them like family. Blue Buffalo offers wholesome, meat-first recipes with high-quality natural ingredients in flavors dogs and cats love. Discover formulas for all breed sizes, life stages, and lifestyles. And with Blue Buffalo's True Blue Promise, that assures that real meat is the first ingredient, with no poultry byproducts, no corn, wheat, or soy, and no artificial flavors or preservatives. Welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified allergist and dermatologist in veterinary medicine. And
I'm Janet Novotny-King. I'm her sister. I am not a board-certified allergist and dermatologist. I'm really not certified in anything, but I'm a pet lover and a pet owner, and I'm here to dumb it down because this doctor speak is way too much.
You're a certified sister and an animal rescuer.
That's right.
Well,
and I'm an expert treat giver.
That's true. You're a very good treat giver. Okay, so we had so much feedback with our Dr. Jeff Powers that we have invited him back. And just to refresh your all memories, Jeff is the owner of Jordan Valley and Beaver Island Veterinary Clinic, and he is transmitting today from Beaver Island, so we have to ask about that. He was president of the Michigan Veterinary Medical Association, and he was the chairman of the AVMA, American Veterinary Medical Association's committee on council, on biologics and therapeutics. That's where we met. And I know he won't like to hear me say this, but he was really the workhorse in forming the AVMA's policy on CBD. He did all the research there, and in my opinion, didn't get the credit. Anyway, he also is owner of Beaver Island Hemp Company. And again, live and transmitting from Beaver Island, we welcome Dr. Jeff Powers today, and we want to talk about senior pet care. What we need to look for in our senior pets that can give us clues that maybe they're not doing so well. Because Jeff, I know you and I used to see a lot of elderly pets.
Mm-hmm. Actually, that's often the majority of pets that we see day to day in a veterinary practice, certainly those that have issues or their owners are concerned that they have issues. And it's something that is very near and dear. I think as you age as a clinician, you develop an extra sense of concern. I think you're kind of notice your own frailties as well as being akin and understanding the challenges that these pets are going through. And these pet owners also, they're deeply in love with their pets, and that love grows over the years. And so it's very rewarding to try to help those, especially it's rewarding helping all levels of pets at all ages, but especially if you can bring about relief and some cures and definite improvement in your senior pets' lives, it really is very rewarding.
And I think we'll probably start at the top. Like, okay, let's with eyes. For example, some dogs have cataracts. Some owners think their dogs have cataracts because they get a hazing of the lens, which is called lenticular sclerosis, and they get that at age 8 and above. But my comment, because my office used to be with an ophthalmologist, and some of these dogs with cataracts, they go toward the light. So we would always tell the owner, don't let them out unattended at night because they're going to go toward car lights.
Yes, that's a big
and also,
concern.
Yeah, and the ophthalmologist would say, just put little night lights around the room, and of course don't change the furniture arrangement, because some of them, they'll go toward these little beacons of light. And would you agree with that, Jeff? Any other comments on that?
Yeah, and I think it's very important, like you said, to when you have a senior pet in your home, dogs don't rely on eyesight as much as we do. They do rely on it, but they become familiar with the surroundings and the smells and the tactile sensations and layouts of the house. I think they develop little maps in their head where everything is. And so if you disrupt this pattern, it can all of a sudden be very confusing. And sometimes a pet that the pet owner thinks has no eyesight problem will all of a sudden start running into things. And then the question is, are they senile, or is it an eye problem, or what is it exactly?
So
True.
what is the definition of a senior pet?
That's kind of variable, but you know, I guess anything, say 7 or 8 years of age and up. But sometimes you could say your large breeds approach their senior years earlier than the small breeds would. Um, so anywhere, say from 6 or 7 to 9 or 10. I mean, I just had a 12 and a half year old Yorkie Cross in there that could have passed for 7 or 8. And yesterday I had a Golden Doodle. It was only 7 years old, and it already has a very severe osteosarcoma in a forelimb. So it's just very much kind of in that range, I would say, for senior pets.
It's kind of like when we talk about humans and we'll say, oh, she's an old 85.
Yeah.
You know what I mean? Like, people say that, or she's a young 85,
Yeah.
It's just a
And
different.
speaking of humans, they say that when you start to lose your hearing, it ages you because you're not part of the conversation. And I've noticed that, owning several 15-year-old dogs in my life, they sleep more soundly. So you never want to go up to them and nudge them. You kind of want to just go like walk heavily toward them to wake them
Oh,
up because you don't want to shock them. And
scare them.
also, when they can't hear, you gotta have to work with hand signals.
Yeah.
Yeah.
But that's a good point. Those are all good points. So it's like some pets age sooner than others. Nutrition and adequate other conditions in the home will definitely be helpful. However, disease can definitely, certainly age a pet faster as
Yeah.
well.
So, what symptoms should owners be aware if they have a senior pet? Like, what
Um,
should they be looking for?
well, I guess some of the things we sort of talked about, as well as um, perhaps not wanting to get around as much, not eating quite as well, sudden weight gain, sudden weight loss, increase in urination, um, increase in frequency in urination, things like that would be possible issues. Um, I guess those would be just a few. Hair coat problems as well. Um, that thinning of the hair coat or excess flakiness. I know Alice, I'm sure, has talked about a lot of
Yeah.
dermatologic skin diseases that increase as pets age. Those would
Well, and
just be,
also, Jeff, having said that, lack of grooming. Like when
Yeah,
you have a
cats.
cat that doesn't want to groom anymore, are they not grooming because they if they turn around they're arthritic? But
Right.
lack of grooming is kind of like when you just don't care anymore, you know?
That's what I found with Dexy when she was, what, 19 and a half, the
Hmm.
cat, is she had, she just didn't look pretty anymore. You
Well,
know,
you're right. I mean, they
she
lose
couldn't take
muscle
care of
mass too.
herself.
My
Yeah.
21-year-old Capri, I I love when I see her like licking the insides of her front paws after she eats because I'm like, she still gives a crap about how she looks. She might not do her whole body, but at least she's doing her front paws.
she's
So my
doing what
se-
she can do.
my
Yes, good.
senior pet is slowing down. My dog is slowing down. Should I force exercise? Like, come on, let's go for a walk. Should I?
Well, I think that's a really good time to go to your veterinarian and get a thorough examination because it could be any number of things. It could be arthritis, like we talked about. It could be heart disease or
Oh,
respiratory disease, starting to make it more difficult for them to get around. Or it could have some other internal organ issue that's causing them perhaps to lose a little bit of blood and perhaps be a little bit anemic. So anytime you see anything like that, sooner rather than later, will give you the best chance of aiding your pet as well as catching whatever disease processes are in process and helping to do what we can to reverse or slow those effects.
So
And
my
Jeff,
friend,
what age do you recommend people starting to get yearly or every 6 month blood work?
We always recommend at least around 8 years of age, unless there is some other condition that's become obvious or some issue ahead of time. It's always a good idea to do blood work. I mean, we sometimes find problems in very young cats and dogs, just a year old, 2 years old, and so. But eight, say your dog is going around doing extremely well. 8 is a really good age to really consider getting blood work done, and honestly, x-rays and maybe even an ultrasound, just because there's a lot of, especially in certain large breeds like labs and things, there's tumors and that can crop up in the abdomen and just be a slow drain on their body, and aren't noticeable really to the pet or to the owner until the disease is quite advanced. So I always recommend that. It doesn't always get done, but it's something that if you want to do the best for your pet, anytime you're closer to that middle age range, about 7, 8 years old, that's definitely a time to start.
now my friend's lab was we don't know how old it was because it was a rescue, but the bones along her back started to kind of protrude, and I think that's from what lack of use. It like as she got older, her spine was you could almost see it. Does that make sense?
Yeah, that could be like muscle loss.
Yeah.
That could be due to, say, a number of things. Could be due to generalized weight loss. Some endocrine hormone problems can cause like muscle wasting. If there's some like neurologic damage into the spine, that could cause that, where they lose muscle mass and weight and the bones would protrude. So those would be just a few of the things that seeing that could tip off several conditions.
And how do you know when your pet's in pain?
Um,
Like
that's
what
a
are some?
good that's a really good question, because I think pets in general are quite stoic. I mean, there are pets out there that will yelp in pain when they're moving. A lot of times it's things like, well, they don't jump up on the couch anymore, or they don't jump up on the bed, or they don't want to play as much as they used to. I had one golden, she's 12 and a half now, but about 2 years ago, she was playing with a younger dog and hurt vertebrae, strained some vertebrae in her neck. And she was having a really hard time even drinking water all of a sudden.
Wow.
Just anything out of the ordinary. The more you know what your pet's normal is, it's easier to uh, see those things where something out of the ordinary is occurring.
Yeah.
And I was reading some things, Janet, and this is true because I've noticed it in my pets, even around the mouth. Like we had an office cat that we fed it canned food, and the food was like all over the walls. And I said to my technician, I said, "What's going on there?" Well, and this was little Jerry, and little
Hmm.
Jerry was almost feral, and that's why I adopted him, because I knew he wouldn't make it in a regular home. So we gave him a little sedative and looked in that mouth, and he had a tumor in the mouth. And so if they're chewing
Oh.
on one side, if they're drooling, if you notice that they can't completely prehend or chew their food, tilting their head, pawing
Huh.
at the mouth. I mean, it's not that. And of course, he was started to lose weight because he couldn't
Yep.
eat. There's a tumor in there. But people chalk it up to, oh, he's getting old. No, there might be something that we can fix here.
Yeah.
Yeah. So I always tell people, look at your dog's mouth. You don't have to even open it. Just kind of go and look at the gums, but also look at the rectal area.
Yeah.
Because Jeff, how many times have you picked up the tail of a collie and there's maggots there in the
Oh my
middle of
God.
summer? Or a cat, because a fly lays an egg there and nobody looks under the tail, you
No,
Yeah,
know?
nobody wants to.
So mouth and butt, you got to
yeah.
look at those places.
And that's a great point, because like 80 to 85% of pets do have some level of dental disease. Many pet owners are doing a great job brushing their teeth and doing what they can for oral pet hygiene, but that's very difficult. And like
Yeah.
we had a cat last week that had a clicking sound in its mouth, and it did. It had a growth between the outside of the molars and the cheek on the one side, and it was still eating and everything, but it had a growth. And fortunately, it was a type that was not malignant, and we were able to treat it with anti-inflammatories and then remove it. And rectally, like you said, so many times it it can be, you can have all sorts of tumors, especially in intact male dogs. You'll see a lot of what's called perianal adenomas as they age, and
Mhm.
that can cause extreme discomfort. Or just like a case I had just the other day is just a basset that is just a little overweight and has a lot of like excess skin folds around his rectum, and it's just causing sort of a skin fold moist dermatitis that is
Oh,
driving the poor dog crazy.
Mm-hmm.
And so we're doing, I gave a little bit of a lecture about how we really have to get this dog to lose some weight,
yeah.
and hopefully make some diet modifications, as well as attempting to treat the area as best we can.
Wow.
Yeah, and I don't think a lot of people that say get these French bulldogs or English bulldogs, they have facial fold problems. They have that screw tail, so there's a fold in there, and that just collects yeast and bacteria, and sometimes, and same with the lip fold. Sometimes that can smell to high heaven. So if there's an odor coming from anywhere in the dog, that needs to be looked at as well.
Yeah, I had a dog just yesterday with it was a big lab, but it had a bad lip fold dermatitis where the dog's teeth actually were pretty good shape. But in that fold, like right underneath here, there's a big fold and a crease, and it
Yeah.
was just collecting and ulcerating and having a real, like, not a good odor.
It's got to be painful too. And the other thing too is sometimes you get an odor from the dog's mouth, and yes, it could be the teeth. But I'm sure Jeff, you'll agree with it with this. I've taken hemostats and pulled out embedded hair from
Oh,
Oh,
those
yeah.
teeth because the dog's been chewing, and you can imagine that hair that's stuck there for weeks at a time.
Oh,
The
yeah.
odor that Janet, Jeff and I, it's you can't worry about smells. If I
right.
walk into the exam room and I smell something, I'm on the hunt. I'm
Yeah.
looking, where is that smell coming from? Because that's the bad area.
If there's smell around this house, it's a dead chipmunk.
Yeah.
Yeah, there you go. I've even had dogs that have had, usually they'll paw at their mouth, but I've had a few that have had like a stick lodged in the
Oh,
top or the roof of their mouth crossways, and it'll
yep.
cause erosion into the gums and infection.
Oh,
And the dog, some majority of time they'll be pawing at their mouth, but
right.
occasionally you'll get a
Yeah.
real stoic dog and it isn't bothered by it that much.
So that happened to us with one of our Goldens, and it was stuck across. And my son and I literally got pliers because you can't grab it. It's
No.
slippery, right? And you could see the relief on the dog because I'm sure it was pushing like
Oh,
braces
yeah.
on. Oh my God, it looks so painful. Oh,
So many pet owners, unfortunately, you'll find the dog is just loaded with cancer, and there's no clue because the dogs are so stoic and they don't show any
yeah.
change in anything. And that's when I had adopted a golden Cindy at 15, at 11, and she lived to 15 and a half. And I'll tell you something that mystifies me to this day. I would walk her at the park, which is a 3 mile walk, and toward the end, she just didn't want to walk. And she wasn't overweight, and I did blood work on her, the whole bit. She had a brain tumor. And that was a symptom. And of course, then she started circling, okay, and then seizures. But that was the first telltale symptom of this brain tumor. She didn't, and I felt like, come on, it's not even hot. Why aren't you walking? Knock me over with a feather. I would have never guessed brain tumor as that
Huh.
symptom. So there you go. But
Yeah.
anything out of the ordinary. And that
That
was out of the ordinary for her.
Well, our old Golden Shaggy would have he had Lyme 3 times, and when he would go to get up, he was like an old man, like he couldn't. And that was when I knew we had to get him to the vet for the doxy, because
Yeah.
even though he had the shot and all that stuff, the vaccine, but you could just tell something was off, and he wasn't as playful. So that's a good tip for pet owners. That
Yeah, I have a
something's-
dog that I'm treating right now for Lyme disease, and it has a facial paralysis on one side. And the owner noticed that the dog had been like drooling a little bit and sort of acting funny on one side of his mouth. And so when I did they'd actually done a Lyme test 2 years ago. I think they missed last year, but when I did the test this time, the dot was just extremely hot, indicating a high level of reactivity to the Lyme bacteria. And so we started treating with doxycycline. Actually, he's bringing the dog in tomorrow for a recheck. It's doing a little bit better, but sometimes those neurologic diseases, as a result of that type of condition, are never going to totally go back to normal.
True. How true for humans too. Neurologic, cardiac,
Yeah.
hyper kids with autism. They're finding now have tick-borne disease. I mean, it's amazing how infectious organisms can be at the root of so many things.
Yeah,
Is
and
is the canine Lyme test the same as the human test?
I don't believe it is.
Mm-mm,
Okay.
mm-mm.
Okay.
So,
And
like,
in
there's
humans, it depends on which lab you use too, Janet, and you know
Well,
that.
if you go to your regular GP, it's the 3 things. And
Yeah.
if 2 are no and 1 is elevated, it's still
Yeah.
a no. But it's
Yeah.
really a yes. But anyway, we won't go there.
where I am up on Beaver Island, I've been keeping track of the presence of Lyme's and anaplasmosis for the last decade. And we're seeing, in spite of people having a lot of prevention and vaccine treatment, we're still seeing 13 to 14% of the dogs test positive for Lyme disease, and about 8% test positive for anaplasmosis. And every once in a while, I'll get a pet that has never been, like, it's pretty rare these days, but over the years, I'd find pets that had never been on prevention or vaccination. 100% of them have Lyme disease.
Isn't that something?
Wow.
Wow.
And that's increasing all along the coast, not only on like the island here, but all along the western coast of Michigan, down by like Sleeping Bear Dunes. And those practices now are seeing extremely high rates. And we're seeing it in other areas of Michigan that we hadn't seen it in. It's just ticks are increasing in prevalence year after year.
They don't die. And our friend who lives in California, her son, they had been on the East Coast for summer and they went back, and she's a nurse, and he's now in his 20s, but he was probably like 5 or 6 years old, and she knew he was presenting like he had Lyme, and the California doctor, this is 20 years ago, really didn't know what to do. And she insisted, and they tested him and he had it, the little guy. So now it's really problem. Our son, when he went to school in Tennessee, got it, and he literally had the tick on him, and he got Lyme again.
So Jeff, with your clients, you're Lyme vaccinating them. Do you think that's cutting down on
It does
any
definitely
incidents,
cut down on the incident. I've only ever
Okay.
had
Good.
a few cases that they've received the adequate series where they do a vaccine, a booster, and then an annual booster. I think there's only been 1 or 2 cases that ended up positive for Lyme disease. I've had a number of them that like didn't get the vaccine sequence. Maybe they got 1 booster and didn't follow through. And then there's a lot of people that say, you'll discuss with them whether their dogs had ticks, and they'll say, no, it's never had a tick on it. And then you'll do the test, and the test is positive. And then that's like, well, how did that happen? Well, obviously there was a tick at some point, and it can only take like 33% of adult ticks, I believe, are positive with with Lyme bacteria.
Yeah.
Wow.
Hey, did you know that for dogs and cats that could benefit from a prescription diet, Blue Buffalo offers natural veterinary diets formulated by animal nutritionists and veterinarians for certain dietary needs like kidney support, weight management, gastrointestinal support, and my particular favorite, dermatology. They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF. Contact your veterinarian about these prescription Blue Buffalo diets.
So can we switch gears and talk about why vet care is becoming so expensive?
Sure.
Absolutely.
Well, I can add my 2 cents on that. I was, these private equity firms now, well, as of 2020, are owning 30% of the practices. And what private equity firms do is buy, keep it for a while, then sell it, kind of like flipping.
Exactly.
Right.
Okay.
Exactly. No
And
matter what the business is, that's what they do.
And I was telling Janet that a private practice in New York City that was vaccinating cats for rabies in 2022 was charging $27. They sold to a private equity firm. Now in 2024, the same vaccine is $50.
Yeah.
So it's doubled.
Yeah.
Yeah, pretty much. Yeah.
Are pet owners, do you find more pet owners now have pet insurance?
Jeff, why
There's
don't
a
you
slight
say that?
there's a slight increase in that in pet owners with pet insurance in our area. I think that varies in various parts of. We're in a lower middle class area, so we have increasing amounts of people, but still it's in the single digits that have pet insurance, and it's just like the cost of medicine. It seems like I agree that the private equity involvement has came into the field of veterinary medicine basically like the veterinarians are wonderful people, but they're poor
Right.
business people, and they identified it as an area where they could increase profits and harness some of those profits. I don't think they would be interested in it otherwise. Um, they added structure, I believe, so there's probably been some value in that. However, it has obviously the costs. That's just one example. The costs, I know we've had comparison costs done with various procedures that we do in our clinic, various like radiographs, blood work, things like that. And I believe we're somewhat middle of the road when it comes to private practices, but when you compare it to a lot of the corporate practices, we're much lower than what rates they're charging. And that becomes even more difficult every year because not only, I think, with the increasing cost from overall procedures, a lot of the suppliers and like lab equipment and lab tests and costs, which many of them are aligned with some of the corporate players as well, their costs have gone way up. So it's put the squeeze on pet owners as well as practitioners trying to do a good job in providing care. I think, we talk about senior pets. I mentioned all these things that would be great to do. Many times when someone brings their pet in, we are not able to do all those things because, we have to work within their means. And I think Alice and we've had to do that so long that even through all this with the inflation that's also hitting everyone, it's very hard to do that. But it's something I try to do all the time is be as frugal as possible, but also be as thorough as possible, because you don't want to miss something because you were unable to do it. The problem with saying, let's just do everything for everyone, a lot of clients won't say they can't afford it at all, or if they're faced with an extremely high cost of attempting to determine what's wrong with your pet, then it will go to, unfortunately, euthanasia comes on the board. And I mean, I do everything possible to provide people with a rational approach to try to do what we can for their pet. It's tough, but it's kind of one of the more rewarding things if you can help someone And I think as we get more corporate and structured that way, unfortunately, we risk losing some of that.
Well, and I think it's a credit to veterinary medicine. We kind of have to pick and choose which test is going to give us the biggest bang for our buck, knowing that the client, whether they're strapped or not for money, you know, if that person drives a Mercedes in or an old Ford Escape, I'm still going to give them the same options, okay? And I think that's where we don't get enough credit. In human medicine, hey, we've got insurance. They can run whatever they want. The other thing that's sad about veterinary medicine, I just had one of the rescue golden owners contact me today. The dog it's an 11-year-old golden and it's circling. Now that could be idiopathic vestibular, but it could be a brain tumor. And I can tell you from the get-go, she doesn't have $5,000 for an MRI. And I agree with that. I mean, very few people do. MRI in some of these new graduates is kind of just, it needs an MRI. Okay, let's step back a little bit. What if they can't afford that? What can we offer them that they can afford that'll help with these rule outs? I just think that a good physical exam is still not practiced by some younger vets. And I'm sorry I had to say that, but older practitioners like Jeff and I, we weren't raised with MRIs. Ultrasound was a new thing for us, okay?
Right.
So we had to start from the head and work down to the tail and do a good physical exam. And I think that is not given the honor that it should have anymore.
Yeah.
Well, because they have diagnostic tools.
And
Yeah.
Right.
but the thing is, and that's a great point, because all the diagnostic tools are wonderful, but if you've done a thorough physical exam first, and then you use the diagnostic tools to help substantiate and build on what you believe initially in the physical exam. I mean, it's wonderful to have all these tools, and it's wonderful whenever possible to use all these tools, but we often have to be practical in developing and providing care for all these pets.
And just because you can do something doesn't mean you should. You know, even in human medicine, I think when I ask my doctor, okay, if we do this test, is this going to impact the treatment you're going to do? Well, no, we just need to, okay, stop right there. You know, I mean,
It's because I have to do it because insurance tells me.
or liability.
Yeah, I just went through this. I didn't
You
need to
did.
have that
You're
one
absolutely
test.
right. You did.
And it showed that I had a bacterial infection, and before they treated it, you know what? No, we have to do this other test where I had to be knocked out, miss a couple days of work, and in the end, they just put me on antibiotics. So anyway, so that's another question I'm thinking about. So, I hear people complaining about the cost humans of pharmaceutical drugs, right? That must be affecting the veterinary industry because a lot of the drugs are the same, if I'm not mistaken.
Yes, most definitely. The costs continue to go up in a lot of the most commonly used products. And, inflation has just hit everyone across the board. And so there are great tools out there now and new advancements. But again, it always falls within the line of what can we do. And I know I actually consider it kind of an honor when a client, I present a bunch of options to someone who has a senior pet, and they'll often say, what would you do if this was your dog? Or what would you do if this was your cat? And I come right out and I tell them. I mean, if I think a dog has a 15 or 20% chance, I'll tell them. I'll give them based on experience. I remember, I think it was an Ohio State veterinarian, Dr. Charlie Bowles. He was an equine veterinarian I had in school, and he was somewhat magical about being able to give clients percentages, and it's something I've always tried to do. And I mean, it's taken a lot of years to be able to do that. Like I had a really bad pyometra in a 12-and-a-half-year-old golden doodle about a month ago. And it ended up doing fine. We ended up having to keep the dog for 4 days, but they wanted to know she'd lost a lot of weight. Her uterus was extremely distended and full of infection, and she was anemic. And I know, just despite doing everything to the T surgically, there's still a almost even money chance she's not going to pull through. And I told him, I said, that's what I said. I said, 50%, probably 50, 70% at absolute best. I said, it's just a step. If we can get her through this surgery okay, then how can she come back the next couple of days? So I don't know. It's all, and unfortunately pets don't live forever. So you want to do what you can as best as you can. And there are many cases now where upper levels of care are available at specialty clinics, and that's wonderful to be able to have clients that can go and get advanced care. And so we do what we can, but we always also, like you said, whether it's a Mercedes or they got dropped off by a van, we got to let people know what is available in veterinary medicine and try to do the best for everyone every day.
Not to be negative, but and I didn't have much of this in my career, but I imagine in general practice you would, where say that same dog didn't make it, and then the owners don't feel they have to pay for the surgery. And my comment to that was, listen, my dad died of cancer, and I still had to pay for that chemotherapy.
Yeah.
Right.
Yeah, I mean, I think you have to be.
I don't know why they see it different in human medicine versus veterinary medicine.
That's very true. I mean, that's why I tend to paint as honest a picture, maybe a little bit on the pessimistic side, but there are unfortunately those cases that can occur like that. And I usually don't have that problem too much anymore, but I think early on, you tended to be sometimes perhaps a little more enthusiastic than you should have been at certain times. And it's just so careful to provide the right balance and most realistic expectations for your clients. But still, anything can happen.
Well, and as a pet owner, I appreciate that because I want to know what's the worst thing that can happen and what's the best thing, but where am I on that scale, right?
Yeah.
And because I don't have the knowledge that you all have.
Well, and I respect that when Jeff said the client will say, "What would you do if it was your dog?" I always tell them what I would do because that's why they're coming to me.
Well,
And I don't understand to not get personal. Veterinary medicine is very personal. It's very emotional. You get to know these dogs. These are like children of yours. You see them as a puppy, and then you're seeing them at 14, and you're seeing then the owners with their second, third, and fourth dogs, of which then they're in their 80s and they're getting like an 80-pound yellow lab puppy because they still think of themselves in their 30s. But I've always told them what I would do because that's why they're coming to me.
I think
Well,
the personal touch in veterinary medicine is so important. And I think it's one thing that we got away from during the pandemic to a degree because so many practices went curbside. And then the clients are not interacting with the veterinarian anymore directly. They're maybe getting a phone call. And I know I was one that we only were curbside about a week. And I just said, this doesn't make sense. And so I said, well, what they're saying is we can't catch this virus unless we're exposed more than 15 minutes. So let's keep the appointments right to the business, keep them a little short. And the thing is that I found especially through that period, people wanted somebody to talk to. And I got asked a lot of questions about everything, as you always do. And I think that hopefully we're coming out of that and we'll reinvigorate that. But I think the corporate aspect has hurt that as well, because in these corporate clinics, a lot of times there's more turnover of staff and veterinarians. And so, and it like you were saying, you're seeing generations of pet owners, pets. That's, kind of a blessing at our ages, our career, is a lot of times I'm treating grandchildren of previous pet owners' pets. I know I can't do this forever. I'm getting near the end of that line, but that's quite a blessing to be able to see those people over and over. And it's funny sometimes because they'll have the same little quirks about how they raised their pet that their grandparents did.
Yeah, that's true.
And how would we have gotten through COVID if we didn't have cell phones? Because I would take the cat, they'd come and get the cat out of the trunk, right, in the thing at the vet, and then they'd call you. But if I think about it, if we didn't have cell phones, how would all of that transpire? They would have.
Well, we would walk. I was filling in for our our small town local vet because she was in a bad car accident. I just walked out to the car.
Right,
or
but-
like we have
Here
a
it
couple
depends on-
windows in our exam rooms. We would like talk to people through the window, sort of like at the drive-through
Dairy
restaurant.
Queen.
Yeah.
Wow.
Jeff, what's the oldest dog that you've had in your practice, and what breed was it?
I know I've
just
had
curious.
some 21 or 22-year-old coon hounds.
Really? That
And
big
I've
of a
had
dog? Huh.
several like husky crosses that have been that age. I had a beagle that was, I think, 21, and
Okay.
Wow.
and then she told me, I think the beagle she had before lived to like 27.
Wow.
That's crazy. And I love when you guys talk, when the doctors and vets come on, you always say, I had a poodle.
Yeah.
Yeah.
Or I had a beagle. And like the way you remember it, it's so
And the thing
endearing.
is,
It really
it's like you all, then immediately as a veterinarian, you're like, what are those people doing with their pet that other people aren't doing? And
I know.
And in
Yeah.
fact, like this
Yeah.
lady was apologetic. Well, I didn't get to get his vaccinations perfectly all the time, but I think a lot of it is they kept their pet exercised. They fed him a good food. They didn't get overweight.
The weight.
Yeah.
Yes.
Wait.
My oldest was I had a 15-and-a-half-year-old golden and Irish setter, but my oldest patient was a 21-year-old dachshund. A lot of dachshunds live along till a ripe old age, and it was owned by an elderly couple, and their vet thought that it had lymphoma, and it went then to the specialty clinic because the regular vet was going to start chemo, and the elderly Mrs. owner said, I want to think about this for a little bit. Then they took it to the specialist, and it didn't have lymphoma. And so then I saw her on the schedule for that day, and I said, oh my gosh, I had heard, Taffy had lymphoma. No, she didn't. So, and then I love it because the owners would say to me, now, Dr. Alice, Taffy's going to act like she likes you, but she'll bite you. And
Yeah.
they were right. But she didn't have lymphoma. I don't know why her nodes were up. But anyway, so thank God they didn't start the chemotherapy. And then I also had a Maltese that was like 18. Some of those little white dogs live a long time, too.
Yeah.
Well, a friend of mine, her dog, its name is Hoosier because they're from Indiana, and it just went for its final radiation treatment, appointment, and they put a little graduation cap on him and took a picture. Like humans ring the bell or
Ring the bell.
whatever. So I thought that was really cute.
Yeah. What
Yeah.
kind of dog is that?
It's I don't remember. I've met him, but there's two, and I can't remember which one it is. It's either like a lab-looking one or a fluffy one, so I don't remember. But cute as a button.
So, Jeff, what's going on at the island today? You're there for the weekend?
And the most important thing up here on Memorial Day weekend is the Memorial Day parade and ceremony that they have. They have a nice called Veterans Park right on the harbor, and they have plaques. Like I have for my grandfather and my uncle and my father
Wow.
who served in World War I and World War II. So there's all these memorial plaques. Everyone has a plaque in honor of their service members. And so there's a ceremony that will occur on Memorial Day morning. And that's the most important. That's what Memorial Day is all about.
Absolutely right. Janet and I are from a little town called Euclid, and the biggest parade of the year was the Euclid Memorial Day Parade, and it was just fabulous. Yeah.
We have two here, one in our town and one in the town right
We
next
have
to it.
we have one here in Richfield. It's like
And
it
it's,
goes like that. It's real quick.
but it's like red, white. It's
Yeah.
very Americana.
One of my favorite holidays. Yeah.
That's for sure.
Yeah.
So is the island you're on, is it seasonal?
Pretty seasonal. There's like 500 here year round, and then in the summer there's a lot of summer homes. So
Yep.
it's not like Mackinac that it's got a lot of tourism. It's in fact, there's also like this weekend they have a birding festival, so there's a lot of naturalists. People with naturalist interests will come here. So there's the Beaver
Wow.
Island Birding Festival this week. They have during the summer there's a music festival that's gotten very popular, and then also a Baroque on Beaver, which is like a classical music week that's pretty interesting as well.
Wow. Wow.
You'll have to come up.
Well, we will.
I know.
So we're being asked to, Jeff, we need to ask you, and we've asked you this in a prior,
But maybe he has a new pet peeve.
yeah, do you have a new pet peeve?
A new pet peeve about
Humans or pets?
Humans or pets? Probably a human one. Because I get a lot of those pet peeves on texting from you.
oh yeah. Yeah. Well, I don't know. I guess it's clients that don't have a lot of compassion for their animals' problems. Sometimes I have issues with that, and I just try to do my best in that case to be as enthusiastic and to increase their level of concern about their pets issues. It's hard to deal with as a veterinarian when there's a pet sitting there that has giving unconditional love to people and they're not being cared for as well as they could be.
Yeah.
You know, well,
Well,
listen,
thank
Janet,
you.
you and I have to road trip someday up to Mackinac when he's there, and also to Beaver Island. But we're taking the ferry, not the plane.
There you go.
Yeah,
because it's a little plane. Yeah.
Yeah.
yeah. I'll get back to you on that, Janet, later.
Well, thank you, Jeff. This has
Yeah,
been
have a good weekend.
Okay,
Tell
you
Jeff I
too.
said hi.
Okay, I will for sure.
Hey, thanks for joining us today. We want to thank Dr. Jeff Powers, we love him as a guest. We love all of his knowledge of general practice in veterinary medicine, even if he is from Michigan. Don't forget to check out Beaver Island Hemp, which we'll have a link to at the end of the show. And for now, this is Dr. Alice Novotny-Jeroman
and
and
Janet Novotny King saying thanks for listening. Don't forget to like, share, and review us. We love thumbs up.
have a great day. Bye-bye, y'all.
Bye.
Hey, thanks for tuning in today. We hope you found the science-based information provided helpful in taking care of your pet. Check out our other Speaking of Pets episodes wherever you get your podcasts.
We'd love to hear from you. So email your pet photos and or pet peeves to contact@speakingofpetspod.com. Remember to follow Speaking of Pets on all social media.